I'm sorry I was late coming in, but I had to go to the restroom and I was washing my hands and singing happy birthday twice. No, I didn't sing, I counted. 20 seconds of washing. But that's an important reminder. We need to give ourselves permission and time to do the good health hygiene that the governor talked about. I wanted to just let you know that one confirmed case that is from your area is out of over 100 that we have tested so far at the Department of Health. We have about 50 more specimens. Okay, these are specimens that are sent in from providers across the state to test. I just was on the phone with the epidemiologist trying to see, people have asked how many of those 50 are from this area. And there's probably about 10 more specimens from this area to be tested. You've already had other ones that have been tested and tested as negative. There's only been one that's been confirmed. But that's from a broad area. It's Kearns County, Anoka area, so it's a broad kind of regional area in here. But that's the latest update on the specimens that are being tested here. If we get another probable one, then we would send that to CDC at this time. We're hoping that we will have the reagents and the procedures and the protocol to actually be able to do that testing by the end of the week or the first of next week at the Minnesota Department of Health, so we don't have this lag in having to send it to the CDC. But as the governor said, you can expect that there will be more cases. And that's not unusual. We're still in the end of the flu season here. And what we don't know is whether this novel influenza is going to just die out on its own. It's just an end at the end of the flu season. Whether it's going to actually escalate into a pandemic and spread more, or whether we will actually have, as what happened in 1918, where there's a mild phase, and then subsequently 3 to 4 months later, you have a more severe phase. Just want to remind you that flu is unpredictable. It changes, it mutates. That's why you have to get a flu vaccine every year, because the virus changes, and that's what makes it so unique here, is how rapidly it can change and how unpredictable. And I think if some of you saw Mike Osterholm, he's well known nationally and locally as an epidemiologist. He said if someone can predict for you what's going to happen next, they're dead wrong and you shouldn't trust them. This is the unpredictability of the influenza. But the good news is that we are ready. We are ready as a state, and you are ready as a region. At 2 a.m., when I called your Director of Local Public Health, Renee Pawlenty, and I called her and said, Renee, we got the first case and it's in your area, she was ready. She knew exactly what she was going to do. She had an emergency team, management team. She said, I'm going in right now, I'm pulling them together, and you saw in coordination with the superintendent and with the other people in this area, the effective response that we had. And this is how Minnesota is ready. You are an example of showing how you're ready to deal with questions. You've got a hotline up. You've got a way for people who don't have insurance to get the medical services they need. So you are setting an example of how Minnesotans are ready for this. One of the things to know is that, as the governor talked, we have the World Health Organization that is kind of giving us the pandemic levels. We're at stage 5 now. There's another measurement called the severity, and severity is according to deaths. As you know, we've only had 1 death in the United States so far that's been reported for this novel influenza. So severity is at level 1 now. And so that we will have to monitor as it goes on. But those are kind of the 2 different numbering systems that you will hear as things proceed. So I think to emphasize, you can expect more cases. We are prepared for how to deal with this, and people need to know the things they can do right now that will modulate, that will mitigate what happens with that severity and what happens with the spread. And that is to wash hands with soap and water, sing happy birthday twice while you're washing to be really effective, and really work with children on this. Children often run their hands under the water, really don't get it. Cover your cough with tissue, so having lots of Kleenex boxes around and places to throw them, or coughing into your sleeves. So cover your cough and sneezing. Staying home if you're ill. Employers figuring out ways that employees can stay at home if they're ill, and sending them home if they come to work if they're ill, and for people to take care of themselves. Don't touch your nose and your mouth and your eyes with hands. That's the way germs spread. That's the way this influenza can spread. And then just basic, what does your mom say? Get a good night's sleep. Eat your fruits and vegetables, take care of yourself, have regular physical activity. Those are things that Minnesotans can do right now that will have a huge impact on how this influenza spreads.